Let's talk a little bit about PM&R. So for people who aren't familiar, what exactly is PM&R? And what does someone who specializes in PM&R do on sort of a broader scale?
Yeah, sure. And I'd agree. It's definitely a not as well-known specialty, although we've been seeing in the field that that's changing. Every year, it seems like more and more applications are coming in for PM&R specifically. That's what they at least were saying
Hmm.
last year when I was applying. Like it's just been skyrocketing. The scores you've needed, because it historically wasn't one of the more competitive specialties. And
Right.
now even the step scores that you need are slowly starting to creep up. But yeah, just so as a broad overview, PM&R, which stands for physical medicine and rehabilitation. The overarching theme of this specialty is our goal is to get patients back to a higher level of functioning or whatever functioning that they were at prior to whatever injury or a life event that caused them to be in a different functional state. So that could be anything from a high level athlete who tore their ACL and was out of sports to someone who had a stroke and now definitely their baseline is going to be changed, but the goal is to get them as rehabilitated as possible so that they can have the best and most optimal level of functioning based on their circumstances. So PM&R, it's actually a much broader field than people think as well. Like you
Hmm.
have neuro rehab out of it. You could do pediatrics. A lot of patients like with cerebral palsy we treat and work with. You could do sports medicine, pain management. There's a lot of different facets to it. So that's kind of a broad overview of what the specialty does.